The talking point today was about risk versus reward. Choosing not to get the vaccine, they say, will leave you open then to getting COVID-19, which they say is actually worse than the vaccine, of course. And those blood clot side effects are literally about 1 in a million. Albert Blankley with Common Ground Health says the blood clot side effects that started the pause on the Johnson & Johnson vaccine are quite rare.
We're talking about, an incidence of less than 1 in a million.
He says the system is working exactly the way it was designed to.
So we have an incredibly rare event that wouldn't have been seen until a lot of people were being vaccinated.
Dr. Michael Mendoza says this is certainly a setback in the efforts to vaccinate, but like Blankley, says this is a sign the system is working.
So, these events are unfortunate. But I do think that this gives us time to evaluate more fully.
A psychologist with Rochester Regional Health said today, if you're feeling anxious about getting any of the vaccines, talk to your provider.
Talk with their providers and try to get their questions answered. Go to the source of the people that are the experts and try not to rely on stuff like social media to get your information.
Dr. Marielle Davila says all the COVID vaccines went through a rigorous process to get approved by the CDC and FDA.
Patients can feel pretty safe that these vaccines do work and the side effects are minimal.
But Blankley and Mendoza say this setback is not a reason to not get vaccinated.
When we think about, risk versus reward for the vaccine versus COVID, what we're talking about here is a really incredibly rare event.
And All Today said when this research is done on the J&J vaccine and blood clotting, it could very well be revealed that there is no connection between the two. We'll just have to wait and see. In Rochester, Christian Garzone, News 8. Adam Maureen, back to you.